I don't have a husband.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam.
So today we will have our uh, remaining 2 lectures of the endocrinology. We will finish them in the morning, and in the afternoon time you will be having the physiology lab on campus. And next week we will have the tutorial of this endocrinology, all 4 lectures. The tutorial will be in the lab time next week, inshallah, from 1 to 3, and that will also be online. Okay, so let's start today's lecture of lecture number 3, which is about the adrenal gland. The adrenal gland is present just close to our kidneys. It is present at the top of the kidney. So we have 2 kidneys, and on the top of each kidney, there is a cap-like structure, which is known as adrenal gland. That is why the name is adrenal. Ad means close, adjacent, nearby. So adrenal means it is close to the renal, or it is close to the kidney, or adjacent to the kidney. So there are 2 adrenal glands in our body. And if you make a cross section, if you cut it, you will be able to see 2 different parts: an inner portion, which is called medulla, and an outer portion, which is called cortex. So adrenal gland consists of 2 parts: an inner part, which is adrenal medulla. It secretes different hormones, and an outer part, which is adrenal cortex. The hormones secreted from adrenal cortex, they are different from the hormones secreted from adrenal medulla. And the outer part, you can appreciate that it is in the form of the layers. So there are different layers, and these layers secrete different types of hormones. So the hormones which are synthesized and produced from the adrenal cortex, they are all steroid in nature, and they are synthesized from the cholesterol. And the number one hormone is cortisol, then aldosterone, and then there is a type of sex hormone, which is dihydroepiandrosterone. So these are the three different hormones which are secreted from the adrenal cortex, which is the outer form of the adrenal gland. Cortisol, aldosterone, and dihydroepiandrosterone. Cortisol is mainly concerned with the regulation of glucose metabolism. So it is also known as glucocorticoid because it is concerned with glucose regulation. Aldosterone mainly regulates the minerals such as sodium levels and potassium levels in our body. So it is also known as mineralocorticoid. And dihydroepiandrosterone is a type of sex hormone. So we will see what are the functions of the cortisol, and then what are the functions of the aldosterone, and how these two hormones are regulated in our body. So first, we will talk about cortisol. So mainly we said that cortisol is involved with regulation of the blood glucose. So what is the effect of cortisol on blood glucose? It will increase the blood glucose level. By which mechanism? By stimulating gluconeogenesis. What is gluconeogenesis? Genesis means synthesis or production, and neo means jadid, new. So gluconeogenesis is the synthesis of new glucose inside our body from non-carbohydrate sources. So cortisol will stimulate the enzymes which are responsible for the synthesis of new glucose, that is the gluconeogenesis process. So when this process is stimulated, new glucose is synthesized in our body. So this will result in increase in the blood glucose level. Also, cortisol will cause inhibition of the glucose uptake by the cells. So glucose levels will increase in the blood, but this glucose will be inhibited from entering inside the cells. So as a result, glucose will stay outside the cell in the blood. So blood glucose level will increase because it is not allowed to enter inside the cell. So it will stay outside. So in the blood, glucose levels will increase because cortisol stimulates gluconeogenesis and cortisol inhibits the glucose uptake or glucose entry inside the cells. So as a result of these two mechanisms, that is by stimulating gluconeogenesis and by inhibiting glucose uptake by different cells, the cortisol results in increased blood glucose level. So if a person is having high cortisol levels in his body, his blood glucose will be high because the cortisol will stimulate gluconeogenesis and it will inhibit glucose uptake. Then the effect of cortisol on protein metabolism is that it stimulates protein breakdown or protein catabolism. So when proteins will be broken down, the amino acids will be released because proteins are made up of amino acids. So when proteins are broken down, amino acids are released. So blood amino acids will increase. So if a person is having high levels of cortisol, there will be excessive protein breakdown in his body. And there will be blood amino acids will increase in his body. And on the lipid metabolism, the effect of cortisol is the same as on the protein. So cortisol causes lipid breakdown, which is known as lipolysis. So when lipids are broken down, fatty acids are released. So blood-free fatty acid level will also increase. So cortisol is causing lipid breakdown, it is causing protein breakdown, and it is causing increase in the blood glucose level by stimulating gluconeogenesis and by inhibiting glucose uptake. So these were the metabolic effects of cortisol on carbohydrates, proteins, and fats. Then it has other effects also. Cortisol acts as anti-inflammatory and immunosuppressive agent. Immunosuppressive. What is the meaning of suppressive? What is suppression or to suppress? Suppress means inhibition, to inhibit, to decrease something. So immunosuppressive means to inhibit the immunity, to decrease the immunity. So immunosuppressive agents means something which will decrease your immunity. So cortisol, it decrease the activity of our immune cells. And what is the function of our immune system or our immune cells? They protect us from any foreign body, any bacteria, viruses that enters inside our body, that is killed or that is inactivated by the activity of the immune cells in our body. So cortisol, when it is in excess, when there is high levels of cortisol in a person, his immune system will be suppressed. His immunity will decrease. His immune system will be inhibited. So as a result, if somebody has if immune system is inhibited in someone, then what will be the effect? That he will not, his immunity will decrease. If a bacteria or a virus enters in his body, his immune system will not be able to kill him because the immune system is already weak. The immune system is suppressed. So cortisol is an immune suppressive agent, and it is also an anti-inflammatory. Anti-inflammatory means that it acts against the inflammation. It helps to reduce the inflammation. So there are many inflammatory conditions in our body. So in those inflammatory conditions, the cortisol can be given as a treatment because it has anti-inflammatory effects. It decreases the process of inflammation. It resolves the inflammation. Then cortisol inhibits the release of histamine. Histamine is a chemical which is released inside our body when in allergic condition. So it is released from the cells in the connective tissue, for example, mast cells. So cortisol will inhibit the release of histamine. So it will, in the conditions such as allergic condition, when histamine is released, so cortisol will inhibit the release of histamine. So it can be, cortisol can be given as a treatment in allergic condition as well. And it has role in adaptation to stress. So whenever we are exposed to any type of stress, the cortisol secretion increases in our body and it helps to fight against the stress. And cortisol has negative feedback effect on ACTH. What is ACTH? It is adrenocorticotropic hormone. And this hormone is released from the anti-pituitary gland and it controls the secretion of cortisol. So when cortisol levels will increase as a result of negative feedback effect, the cortisol will inhibit the release of ACTH from the anti-pituitary gland. So these are the functions of the cortisol, that it increases blood glucose, it causes protein breakdown, it causes lipid breakdown, it suppresses immunity, it has anti-inflammatory effects, it inhibits the histamine release, and it helps us to fight against stress. And if cortisol levels increase, this will inhibit the release of ACTH from the anti-pituitary. So this is how the cortisol secretion is controlled in our body. Whenever you are exposed to any type of stress, it will stimulate the hypothalamus. So plus sign means stimulation. So when hypothalamus is stimulated by stress, it will release a hormone which is CRH, corticotropin releasing hormone. This will stimulate the anterior pituitary to release ACTH, adrenocorticotropic hormone, which will stimulate adrenal cortex to release cortisol. Now this cortisol, when the amount of cortisol increases, it will inhibit the anterior pituitary as well as it will inhibit the hypothalamus. So the secretion of CRH and ACTH both will decrease. So this is how the cortisol levels are regulated in our body. So this is called hypothalamo-pituitary adrenal axis. Now we move to the next hormone, which is aldosterone, which is a mineralocorticoid, and it is concerned with the regulation of minerals like sodium levels and potassium levels in our body. So the target organ on which aldosterone acts, it is the kidney. And inside the kidney, we have a number of nephrons, and each nephron is having different parts. There is proximal part, there is distal part. So it acts on the distal and the collecting tubules inside the kidneys, and it will cause the reabsorption of sodium from the nephrons. So sodium will be reabsorbed, and it will cause secretion of the potassium. So there is a difference between the reabsorption and the secretion. If something is reabsorbed from the kidneys, that means it will be retained in the body. It will not be passed out into the urine. So when the sodium ions, they are reabsorbed by aldosterone in the kidney. So these sodium ions will be retained in the body and they will not be excreted out in the urine. So with increased sodium reabsorption, it will lead to decrease urinary sodium excretion. So less sodium will be excreted and more of it will be reabsorbed and it will be retained in our body. And when there is potassium secretion in the kidney, that means potassium ions will be excreted out in the urine. So the net effect, what will be the net effect? Sodium levels will increase in the blood and potassium levels will decrease in the blood because potassium is lost in the urine by aldosterone, whereas sodium is reabsorbed and it is retained in the body. So there will be retention of sodium in the body, and this, when the sodium is retained or kept inside the body, when it is reabsorbed from the kidneys, the water will also get reabsorbed automatically because water molecules love sodium ions and they will follow the movement of sodium ions. If sodium ions are being reabsorbed, water will get reabsorbed automatically. So when a person is having high levels of aldosterone, there will be more sodium reabsorption, which will mean there will be more water reabsorption as well. And at the same time, there will be more excretion of potassium. There will be more loss of potassium through the urine. So by this reabsorption of sodium and water, this will affect extracellular fluid volume and blood pressure. Because when more sodium and water is retained in the body, this will increase the blood pressure. So by regulating the amount of sodium and potassium in the body, the aldosterone is a hormone which is essential for life. Because if there is no aldosterone in the body, then the sodium and water will be lost, extracellular fluid volume will decrease, and blood pressure will decrease, so much so that it can lead to the death. Also, the potassium levels, if they are not regulated, if potassium levels becomes too high or too low in the body, this will affect the excitability of the heart. There may be heart arrhythmias, heart beating will be disturbed, so this can lead to death. So aldosterone is a hormone which is essential for the life. Now, how aldosterone secretion is regulated? Since aldosterone is function is to regulate the levels of the sodium and the potassium. So these are the two ions which can cause an increase or a decrease in the aldosterone secretion. So aldosterone secretion will increase if there is increase in the potassium levels in the blood. So increased potassium level in the blood will stimulate the adrenal gland directly to release more and more aldosterone, because one of the function of the aldosterone is to cause loss of potassium from the kidneys. So if the stimulus is increased plasma potassium, this will stimulate the release of more aldosterone, and these aldosterone will then cause excretion of the potassium from the urine from the kidneys into the urine, and this will bring the blood potassium levels back to the normal. So the most strong stimulus for the release of aldosterone is increased plasma potassium. At the same time, if this sodium levels, they are less in the body, in the blood, if there is decreased sodium, this will also stimulate the release of aldosterone from the adrenal gland. But this is, the effect is not exerted directly. It is exerted through the activation of renin, which is a chemical or a protein released from the kidneys. So decreased sodium will stimulate the kidneys to release renin. This renin will act on a protein in the blood, which is angiotensin 1. This protein will get activated and then this will get converted into angiotensin 2. Now angiotensin 2 will stimulate the release of aldosterone. So the stimulus to increase the secretion of aldosterone, there are two stimulus: plasma potassium levels high and low sodium levels. High plasma potassium directly stimulate the release of aldosterone, whereas low sodium levels stimulate the release of aldosterone through activation of renin-angiotensin system. And if you compare the control of aldosterone secretion with the previous hormone, which was the cortisol, so we saw that in cortisol secretion, the control is from the hypothalamus and from the pituitary gland. The pituitary gland secretes ACTH, which is stimulating adrenal gland to release cortisol. But hypothalamus and pituitary gland both have no role in controlling the aldosterone secretion, and aldosterone secretion is controlled by just sodium levels and potassium levels. High potassium level directly stimulate aldosterone, whereas low sodium levels stimulate aldosterone through activation of renin, angiotensin 1, and finally angiotensin 2. Now, what are the diseases which are associated with the adrenal gland? There may be high levels of cortisol in the body, and this disease in which the cortisol levels increase in the body, it is known as Cushing's disease or Cushing syndrome. And it could be due to a tumor in the adrenal gland, or it could be due to a tumor in the anterior pituitary, and anterior pituitary is producing high levels of ACTH. Or it could also be due to excessive use of cortisol, because cortisol is a tablet, because it has many useful effects for the body. So it is given as a treatment, as a tablet, in the form of a tablet or in the form of a ointment or a cream. Cortisol is given for the treatment of a number of conditions, because cortisol has anti-inflammatory effect. So in inflammatory conditions, cortisols are given. For example, the example of inflammatory condition is arthritis, inflammation of the joints. So cortisol tablets are given in inflammation of the joints or in arthritis. So if a patient has been prescribed cortisol as a treatment for some condition, and he is taking high dose of cortisol, then cortisol levels may increase in his body. So this will lead to Cushing's disease or Cushing syndrome. So what happens if a person has got high levels of cortisol? So you know the functions of the cortisol, that it increases the blood glucose level. So if a person is having high levels of cortisol, his blood glucose level will be too high. So he will develop hyperglycemia. Hyperglycemia means high levels of glucose in the blood. And when glucose level increase in the blood, and it increases the capacity of the kidneys, which the kidneys can absorb. So kidneys can absorb the glucose from the filtrate up to a level. But if the blood glucose levels are too high, if it is hyperglycemia, the kidneys cannot absorb all of the glucose that is filtered. As a result, glucose start appearing in the urine. If you do the urine examination in a person who is having high levels of blood glucose, for example, he's having hyperglycemia due to any reason, for example, diabetes type 1, type 2. So if you check the urine from that person who is having hyperglycemia, you will be able to see that the glucose is present in the urine. This is called glucose urea. So what is glucose urea? It is the presence of glucose in the urine. So in a healthy person, in a normal person, glucose is not present in the urine. The urine doesn't have any glucose, because our glucose levels in the blood, they are normal, and kidney is able to reabsorb all of the glucose, and it does not allow any glucose to be lost in the urine. But if a person is having hyperglycemia or very high levels of glucose in his blood, then kidneys are unable to reabsorb all of the glucose. As a result, some of the glucose leaks out in the urine. It is passed out in the urine. So this condition is called glucose urea. So there will be high blood glucose in the blood, high glucose levels in the blood, and there will be glucose present in the urine in case of when a person is having high levels of cortisol.
Plus, there will be excessive protein breakdown because this is the function of the cortisol to cause protein breakdown. And where the proteins are present in our skin to give them strength in the form of collagen fibers. So when there is excessive protein breakdown in the body, the proteins in the skin will also be broken down. So the skin will become weak. Also, the collagen fibers protein, they are present in the walls of our blood vessels to give them strength, make them strong. So when proteins are broken down all over the body, they are broken down in the skin as well as in the walls of the blood vessel as well. So the skin become weak and the walls of the blood vessels also become weak. As a result, there will be bleeding very easily because the blood walls of the blood vessels has become very weak. So just a scratch, just a small touch or just a scratch with a rough surface will cause damage to the superficial blood vessels, and this will result in minute bleeding or minute hemorrhages. Also, there will be suppression of the normal inflammatory mechanism, and there will be suppression of the immune system because we said that cortisol is an anti-inflammatory. So when cortisol levels are high, inflammation will be suppressed. And also we said it is immunosuppressive. So when cortisol levels are high, immune system will also be suppressed. As a result, the person immunity will be weak. So he will have repeated episodes of infection because whenever any bacteria or virus will get entry in his body, yeah, his immune system will not be able to kill that bacteria. So as a result of high blood glucose level, extra glucose will get converted into fat in certain locations, for example, in the face. So this face will appear rounded and full. It is called moon face appearance because of storage of fat around the face. Then what will be the condition? What will be the effects when there is high levels of aldosterone? So you know that the function of the aldosterone is to cause sodium reabsorption from the kidneys and potassium excretion. So if the levels of aldosterone are high, there will be more sodium reabsorption. So there will be excessive sodium retention in the body. And when sodium will be retained, water will also be retained. So there will be more sodium and more water in the body. And there will be loss of potassium, more loss of potassium from the kidneys. So there will be potassium depletion. Potassium will decrease in the body. So due to more retention or due to high levels of sodium retained in the body and high level of water as well, the extracellular fluid volume will increase and this will lead to hypertension. So when there is more sodium and more water inside the body, this leads to high blood pressure. Now, what will be the effects if there is low levels of cortisol and low levels of aldosterone? So cortisol is mainly concerned with glucose metabolism. So if cortisol levels are low, blood glucose will also decrease in the body. So decreased cortisol will lead to hypoglycemia. Hypoglycemia means less glucose in the body. And also cortisol is the main hormone which helps us to fight against the stress. So if a person is having low levels of cortisol, he will have poor response to the stress. He will not be able to cope up with the stress in a better manner. So his ability to fight against stress will become poor. And if the levels of aldosterone are low, so a function of aldosterone is to reabsorb sodium. But when aldosterone levels are low, the reabsorption of sodium will not take place and sodium will not get reabsorbed. It will be lost in the urine. So sodium levels will decrease in the body. So there will be sodium depletion. When sodium will deplete, water will also deplete because water loves sodium and it will move in the direction of movement of sodium. So if sodium is being lost from the urine, water will also get lost from the urine. So sodium depletion will lead to, when there is less sodium in the body, this will cause blood pressure. So there will be hypotension. Also, one of the function of aldosterone is to cause potassium excretion through urine. But if levels of aldosterone are low, then potassium will not be excreted. It will be retained in the body. So potassium levels will increase, and this can cause irregular cardiac rhythms like cardiac arrhythmias. The beating of the heart will be affected. And also, if the levels of cortisol are low as a result of negative feedback effect, the ACTH levels will increase from the pituitary gland, and high levels of ACTH, they make the skin darker by increasing the amount of pigment which is produced from our, there are pigment forming cells, melanocytes. So these cells get stimulated and they become overactive and they produce more and more pigment. So there is darkening of the skin, or there is hyperpigmentation of the skin when the ACTH levels increase. So these are the features which will be produced if a person is having low aldosterone. Then he will have potassium retention and sodium depletion. If a person is having low cortisol, he will develop hypoglycemia. And if a person develops high levels of ACTH, he will develop hyperpigmentation. And the hypotension, like low blood pressure, it may lead to shock. It may lead to circulatory failure or shock. That was about the hormones from the adrenal cortex, the outer layer of the adrenal gland. And now we move to the adrenal medulla, the inner portion of the adrenal gland, which secretes different types of hormones. And these hormones are catecholamines. And these catecholamines are of two types, epinephrine and norepinephrine. And these catecholamines, along with cortisol, they are our stress hormones. They help us to fight against the stress. So whenever we come across any stressful situation, then the levels of cortisol will increase in our body, as well as the levels of these catecholamines, epinephrine and norepinephrine, they will also increase in our body. And these three hormones, epinephrine, norepinephrine, and cortisol, they will then function, help us to fight against the stress. So whenever you are in stress, your sympathetic nervous system is stimulated, and the catecholamines like epinephrine, norepinephrine, they are released from the sympathetic nerves, as well as some of the sympathetic nerves stimulate the adrenal gland, the adrenal medulla portion. So this triangular structure, this is the adrenal medulla. And these blue color, these are the nerve cells, sympathetic nerves. So these sympathetic nerves, when they are stimulated, they stimulate the adrenal medulla, and adrenal medulla releases the hormones, catecholamines, epinephrine, norepinephrine, which will diffuse into the blood. And through the blood, they will be carried to different target organs. So this slide is giving you the concept that when you are faced with a stressful situation, your sympathetic nerves are activated, and these nerves secrete epinephrine, norepinephrine. At the same time, your gland, adrenal medulla, is also activated, and this will also secrete epinephrine, norepinephrine. But the catecholamines which are secreted from adrenal medulla, they diffuse into the blood because these are the hormones. So through the blood, they will be carried to different organs. Now, what is the response of your body when you are in a situation of stress, acute stress, when you are exposed to a sudden stress? What is the acute response of the body? The response is known as fight or flight reaction, because your body get prepared to fight the stressful stimulus, or to fly, to run away from the situation. So whenever you are in stress, your body response, what is your body response? The body response is produced as a result of secretion of these three hormones, cortisol, catecholamines like epinephrine, norepinephrine. And what is the effect? First, your heart will be affected and your heart rate will increase. The speed with which your heart is beating, it will increase. So your heart rate increases, and the force with which the heart is contracting, this force will also increase. So now the function of the heart is to pump blood. Now, when the contraction force of the heart increasing, then the pumping
function of the heart will also increase. So now heart will able to pump larger amount of blood. So there will be increased heart rate. There will be increased force of contraction of the heart. Then there will be generalized peripheral vasoconstriction. Vasoconstriction means narrowing of the blood vessels. So generalized, all the blood vessels will undergo vasoconstriction. They will become narrow, except there are few blood vessels which are exempted and they will undergo vasodilation. Which blood vessels undergo vasodilation? The blood vessels which are supplying your heart muscles, which are bringing oxygen and nutrients for your heart muscles, and these blood vessels are known as coronary arteries. So these blood vessels which are providing nutrition to your heart muscles, they will undergo vasodilation, plus those blood vessels which are bringing nutrition for your skeletal muscles, they will also undergo vasodilation. Rest of all the blood vessels, for example, the blood vessels which are supplying your kidneys, the blood vessels which are supplying your liver, your stomach, digestive system, your skin, all of them will undergo constriction. They will become narrow. Whereas the only exception is the blood vessels which do not become narrow at the time of stress response. They are the blood vessels which are supplying your heart or those which are supplying your skeletal muscles. So except these two types of the blood vessels, rest of all the blood vessels will undergo vasoconstriction. So as a result of vasoconstriction, the blood pressure will increase because the resistance increases by vasoconstriction. So this will increase the blood pressure. The force with which the muscle contracts, they will increase. Your respiratory airways, like your trachea and bronchi, they will dilate. Their diameter will increase so that more air can enter your body and more air can leave. You can get more oxygen and you can remove more carbon dioxide. So there is dilation of respiratory airways. Your breathing rate or respiratory rate, it will also increase. The activity of in the gastrointestinal tract, GIT is the gastrointestinal tract or your digestive system. The activity in that, what is the activity going on your digestive system? There are certain kinds of movements, motility, and there is certain kind of secretions, chemicals are secreted. So all these movements and the secretions going on in the digestive system, they will decrease. The bladder emptying, the urinary bladder emptying, it will be inhibited because you are in a stressful situation and you cannot afford going to washroom to pass out urine. So your urinary bladder is inhibited. The pupil or the hole in your eye through which the light enters inside, this hole will dilate. It will become bigger in size. So this will increase your field of vision. You will be able to look at a distance, far distance. And also as a result of the cortisol as well as epinephrine, norepinephrine, they increase the blood glucose level and they cause lipid breakdown, due to which the fatty acids are released. So blood glucose level increase and free fatty acid level also increase in the body. So these are all the changes that take place in our body when you are exposed to a stressful situation. This is the acute response of the body. It is also known as fight or flight reaction. Okay, that's all regarding the adrenal gland. Do you have any questions?
No, thank you.
Okay, so if there are no questions, we can have a break of 10 minutes and then we will continue with the fourth lecture, inshallah. Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Let's start
وعليكم السلام.
with the last
وعليكم
lecture.
السلام ورحمة الله.
It's the last lecture of endocrine module. It is about the pancreas. So pancreas is a mixed or dual gland because it has exocrine as well as endocrine parts. It secretes hormones such as insulin and glucagon, which will get diffused into the blood, and through the blood, they are carried to different target organs. In addition to these hormones, pancreas also secrete chemicals and juice which is known as pancreatic juice. This pancreatic juice, it will not enter in the blood. It will through a duct or through a tube, it will be secreted in the small intestine, where this pancreatic juice will help in digestion of the food which is present in the small intestine. So pancreas is a double or a mixed type of gland. It has exocrine part as well as it has endocrine part. The endocrine part of the pancreas, it consists of different groups of cells, and these groups of cells, they are scattered throughout the pancreas, and they are known as islets of Langerhans. Langerhans was the name of the scientist who first discovered these cells. So the cells which are present in the endocrine part of the pancreas, which is the islets of Langerhans, these cells are alpha cells, beta cells, delta cells or D cells, and F cells. So there are 4 different cell populations: alpha, beta, delta, and F cells. And they secrete different types of hormones. Alpha cells secrete glucagon, beta cells secrete insulin, and these are the most abundant type of cells present in the islets of Langerhans. The D cells secrete somatostatin, and F cells secrete pancreatic polypeptide. The function of the somatostatin, which is secreted from the D cells, it is to cause inhibition of the B cells and alpha cells. So these alpha and beta, both these cells, they are inhibited by somatostatin, which is secreted from the D cells. And the pancreatic polypeptide, which is secreted from F cells, its function is poorly understood. It may be involved in the controlling the appetite and the food intake. So the major or the main hormones which are secreted from pancreas, they are insulin and glucagon. And in today's lecture, we will discuss the functions of the insulin and glucagon and how they are regulated and what are the diseases which are associated with insulin. So the insulin and glucagon, these are the hormones from pancreas, and they are the main hormones to regulate fuel metabolism. And they are opposite to each other. Their functions are opposite of each other. Insulin is an anabolic hormone, and it increases the synthesis and storage of fats, proteins, and glycogen. So it is anabolic, means that it stimulates the synthesis and storage, whereas glucagon is catabolic. Catabolic means that it will stimulate the breakdown. So glucagon is mainly the hormone which breaks down our stores, the protein stores, fat stores, glycogen stores. And when these stores are broken down, the products are released from them. For example, when proteins are broken down, amino acids are released. When fats are broken down, fatty acids are released. When glycogen stores are broken down, glucose is released. So glucagon is a catabolic hormone. It will stimulate the breakdown of the stores. And insulin is an anabolic hormone. It will build up these stores. It will synthesize these stores of fats, proteins, and glycogen in our body. So both these hormones are reciprocal. Reciprocal means they are opposite of each other in their actions, and they produce opposite effects. Insulin is building, whereas glucagon is breaking. So insulin is a anabolic hormone. This is Burj Al Khalifa. It is very difficult to build such a tall building. So insulin is an anabolic hormone. It builds up the stores of fats, proteins, glycogen in our body. And once these stores are built up, when the glucagon is released in higher amounts, this will then break up all these stores. So first we will focus on the insulin and the action of insulin on carbohydrate metabolism. The insulin will decrease the blood glucose level. And how it decreases the blood glucose? It will stimulate the uptake of glucose into the cells. The glucose from the blood, it will enter inside the cells. So, yeah, and it will stimulate glycogenesis. Glycogenesis. Genesis means synthesis, production, and glycogenesis means synthesis of glycogen. So insulin stimulates the enzymes which are responsible for the synthesis of glycogen. So glycogenesis process is stimulated. And for the synthesis of glycogen, glucose is used up. So glucose will get converted into glycogen. Then it will inhibit the glycogenolysis. Glycogenolysis means lysis is breakdown. So glycogenolysis is breakdown of glycogen. Breakdown of glycogen will be inhibited, and gluconeogenesis, which is, we just learned in the previous lecture that cortisol stimulates gluconeogenesis. But insulin is inhibiting gluconeogenesis. What is gluconeogenesis? It is the synthesis of new glucose from non-carbohydrate source. So this process will be inhibited. So as a result of these functions, that is by inhibiting glycogenolysis, by inhibiting gluconeogenesis, by stimulating the synthesis of glycogen, and by stimulating the uptake of glucose in the cells, what will happen to the blood glucose level? It will decrease, because from the blood, the glucose will enter inside the cell because insulin is stimulating uptake of glucose. So glucose will enter inside the cells. Then this glucose will get converted into glycogen, and there will be no gluconeogenesis. There will be no glycogenolysis. So blood glucose levels will decrease. So insulin is the only hormone that lowers blood glucose level. So we have discussed cortisol, aldosterone, and in the last week's lecture, we discussed the thyroid hormone, the growth hormone. So out of all the hormones in our body, insulin is the only hormone that will lower the blood glucose. Rest of all the hormones, they will increase the blood glucose. But insulin is the only hormone that decreases our blood glucose level. Then on protein, then on lipid metabolism, we said that insulin is an anabolic hormone, and it will stimulate the synthesis and the storage of the lipid stores. So how it increases the synthesis and storage of lipid stores? That it will increase the transport of glucose into the adipose tissues. Adipose tissues are the fat tissues in our body. So glucose will enter inside the fat tissues, and inside the fat tissues, this glucose will combine with the fatty acids, and it will get converted into triglyceride, which is a fat. So insulin promotes the entry of fatty acids from the blood into the adipose tissues. And insulin inhibits lipolysis or the lipid breakdown. So by inhibiting lipolysis and by stimulating, by increasing the entry of glucose into the adipose tissues and the entry of fatty acids into the adipose tissues, the insulin increases the synthesis and storage of triglycerides or the fats. So insulin decreases blood fatty acid level because it is promoting the entry of fatty acid from the blood inside the fat tissues. So blood fatty acids will decrease, and it will promote the storage of triglyceride and fats. Excuse me.
Now on the protein metabolism, also insulin has the same effect, that it will be promoting the synthesis of the proteins, synthesis and storage, and it will inhibit the breakdown. So it will promote the transport of amino acids from the blood inside the muscles and other tissues, and it will increase the rate of synthesis of proteins, and it will inhibit the protein breakdown. So as a result, the blood amino acids will decrease because amino acid will enter inside the muscles and the other cells, and they will be used up in the synthesis of new proteins. So insulin has protein anabolic effect, and it is essential for normal growth. So in the growth process, the protein is it involves protein synthesis, and insulin has anabolic effect. It increases the protein synthesis, so it has a role, and it is essential for the normal growth. So that was the functions of the insulin. Now we move to the function of the glucagon, which are opposite to that of the insulin. So the insulin decreases the blood glucose, but glucagon will increase the blood glucose level. How it will increase the blood glucose level? It will cause the breakdown. It is a catabolic hormone, so it will cause the breakdown of glycogen into glucose. This process is known as glycogenolysis. So glucagon stimulates the process of glycogenolysis, which is the breakdown of glycogen into glucose. So blood glucose will increase. Also, it will stimulate gluconeogenesis, which is the formation or synthesis of new glucose from non-carbohydrate. So this gluconeogenesis will be stimulated, and this will also result in increase in the blood glucose level. Then it is a catabolic hormone, so it will cause breakdown of the lipids, lipolysis. Lipolysis is breakdown of lipids, and when lipids are broken down, free fatty acids are released. And these free fatty acids, they are used in the synthesis of ketone bodies. So there will be ketogenesis. Genesis is production. Ketogenesis is production of ketone bodies. And how the insulin and glucagon levels are regulated in our body. They are regulated by the amount of glucose in the blood. So in the left side of the slide, you can see if there is an increase in the blood glucose level, this will stimulate the beta cells in the pancreas. So plus sign indicates stimulation and the minus sign indicates inhibition. So when there is high blood glucose level, the beta cells are stimulated and alpha cells are inhibited, which when beta cells are stimulated, they will produce more insulin. And when alpha cells are inhibited, they will produce less glucagon. So when there is high blood glucose, it will stimulate the beta cells to release more insulin. At the same time, it will inhibit the alpha cells and glucagon secretion will decrease. So when there is more insulin and less glucagon, the effect of insulin will be more dominant, and the effect of insulin is to produce hypoglycemia or to decrease the blood glucose level. So as a result, blood glucose will come down to the normal level. Now, on the right half of the slide, you can see another scenario in which the blood glucose is less. So when blood glucose levels are low, this will inhibit the beta cells of the pancreas, and at the same time, this will stimulate the alpha cells or A cells of the pancreas. So when A cells are stimulated, glucagon secretion increases, and beta cells, when they are inhibited, the insulin secretion decreases. So in the case of decreased blood glucose level, the pancreas respond by increasing the glucagon secretion and decreasing the insulin secretion. So now when glucagon is more in amount, it will be more dominant, and the effect of glucagon is to increase the blood glucose level. So as a result, blood glucose will come to the normal levels. So these are the stimulus for the release of glucagon and insulin. Now, what is the disease which is associated with the pancreas, mainly with the insulin? The disease is diabetes mellitus, and it is known as mother of all diseases because it starts with the hyperglycemia, but this hyperglycemia leads to a number of complications, and it affects all the major organs in the body in the long run. And it produces several complications. So it leads to several other diseases. That is why it is known as mother of all diseases, Amraz, diabetes mellitus. So there are two types, type 1 and type 2. In type 1 diabetes mellitus, the problem is deficiency of insulin or lack of insulin due to damage of the beta cells in the pancreas. Whereas in type 2, the beta cells are perfectly normal. They are secreting normal amount of insulin, but the target cells are not responding. They have become resistant to the action of the insulin, and there is reduced sensitivity of the insulin in the target cells. So this forms the type 2 diabetes. And this is the table which is showing the differences between type 1 and type 2 diabetes mellitus. So the first row is showing a comparison in the level of insulin secretion. What is the level of insulin secretion in type 1 and type 2? In type 1, the insulin secretion is none or zero or almost none because the cause of the type 1 diabetes is damage to the pancreatic beta cells. So when the beta cells have been damaged, they cannot secrete insulin. So as a result, insulin levels will be low. The insulin secretion will be low, or it will be none, or it will be zero in type 1 diabetes. Whereas in type 2 diabetes, the beta cells are perfectly normal and they are secreting normal amount of the insulin. So the insulin secretion will be normal, or it could be more than normal. It can exceed normal. Why it can exceed normal? Why it will be more than normal? Because the target cells have become resistant to the insulin. So insulin is unable to produce its effect. The effect of the insulin was to decrease the blood glucose level, but now the target cells have resistance, so the insulin cannot reduce the blood glucose level. As a result, there is high blood glucose, and high blood glucose is a stimulus for the pancreatic beta cells to release more and more insulin. So as a result of high blood glucose, the pancreatic beta cells, they will increase the level of insulin secretion. So that is why the insulin levels could be even higher than the normal in case of type 2 diabetes. Now, what is the typical age of onset? The type 1 diabetes, it appears in the childhood, in the children. So mainly the patients, it is diagnosed when the patient is a child. Whereas type 2 diabetes, it starts in adulthood around after 40 years of age. The percentage or the frequency or the prevalence, which one is more common? The type 2 diabetes is more common. 80 to 90% of the patients, they belong to type 2, whereas type 1 is less common, and just 10 to 20% of the patients will have type 1. Then basic defect, or what is the problem, basic problem. In type 1, the problem is the destruction of the beta cells. Pancreatic beta cells have been destroyed. So they are unable to secrete the insulin. As a result, the blood glucose levels are high. Whereas in type 2, it is the beta cells are normal, but there is reduced sensitivity of the target cells. Maybe the number of insulin receptors, it decreases. So the target cells, they are no longer sensitive to the insulin. So insulin cannot produce its effect. And it may be there is a transporter protein responsible for the transport of glucose. It is known as GLUT4. The GLUT4 amount, the number of the GLUT4 protein decreases. Then obesity association. The obesity is usually associated, usually the type 2 diabetes is associated with obesity. So if a person is obese, he's having more risk, he's having more chances and more probability to develop type 2 diabetes, whereas type 1 diabetes is not associated with obesity. Then genetic and environmental factors, they are important for both type 1 and type 2. So if there is a family history in your family, if your parents, if your grandparents, any uncle, aunt in your family is having type 1 or type 2 diabetes, then there are more chances that the children will also develop. So there are genetic as well as environmental factors in both type 1 and type 2. Then ketosis or formation of ketone bodies, it is common in type 1, whereas it is very rare in type 2. And treatment in type 1, the problem is that insulin is not there because the pancreas beta cells, they have been destroyed. They are not secreting insulin. And because of the absence of the insulin, the glucose levels are high. So the treatment is to give them insulin injections because there is deficiency of insulin. So if you give them insulin, this insulin will it will bring the blood sugar level, blood glucose level back to the normal. Plus, the patient is advised to do regular exercise and his diet is planned specially to have according to his condition, the dietary management is done. Whereas in case of type 2, the problem is not with the insulin secretion because insulin levels are normal or even more than normal. So the problem is not with the insulin. The problem is that the target organs, they have become resistant. They are not responding to insulin. So there is high blood glucose level.
So the patient is given dietary control. They are usually obese, so they are prescribed a low caloric diet with less amount of carbohydrates, and they are advised to reduce their weight, and they are advised to do exercise regularly. So there is diet control, weight reduction, exercise, plus there are oral hypoglycemic drugs. Oral means that they are taken by mouth, they are taken orally by mouth. Hypoglycemic means that the purpose of these tablets is to produce hypoglycemia, which means less glucose in the blood, because the problem is high blood glucose. The patient is having high blood glucose, and this high blood glucose is damaging to different organs. It can lead to complications. So to bring this blood glucose level down, towards the normal, he is given hypoglycemic drugs orally. So these are the treatment for type 2 diabetes. Now, what are the symptoms? What symptoms mean? What the patient will feel, what he will come when how he will come to know that he's having a problem, and what he will tell to the doctor when he visits the doctor. So the symptoms or the complaint, there are three polys: polyuria, polydipsia, and polyphagia. Poly means excessive, more. Polyuria means excessive urination, frequent urination. A normal person, he goes to bathroom to pass urine after every, you can say, 5 hours, 6 hours, or even 7 hours. They feel a need to go to the washroom to pass urine. But in diabetes, when there is high blood glucose level and kidneys are unable to reabsorb all of this glucose, so this glucose start appearing in the urine. So when glucose is excreted out in the urine, glucose also attract water molecules. So more glucose in the urine means more water will also be there in the urine. So amount of urine which is formed, it increases in diabetic patients. In a normal person, urine formation is almost 1.5 liters in a day. But the diabetic person, his urine formation increases. So as a result of more formation of the urine, he needs to go to the bathroom after every 1 hour, after every 30 minutes. He feels a need that he needs to go to the washroom to pass urine. So there is more frequency, or there is excessive urination or excessive formation of urine. So even at night when they are sleeping, they feel a desire to go to the washroom to pass urine after every 30 minutes, after every 1 hour. So their sleep is disturbed. So the first complaint is the polyuria, that my urine formation has increased. I need to go to the washroom to pass out urine again and again. Then next complaint is polydipsia, which means excessive thirst. They will feel more thirsty. Their feeling of thirst will increase. Why? Because they are passing out urine, they are forming a lot of urine, and urine is lost from their body, which means the loss of water from the body. So they feel dehydrated. There is a lack. They feel that they are dehydrated, and actually they become dehydrated because they are producing a lot of urine, and they are losing a lot of water from their body. So they get dehydrated, and dehydration stimulates the thirst center. So they feel excessive thirst, and they need to drink water, a lot of water. And then polyphagia, which means excessive eating, excessive food intake. So they will say that my appetite has increased, my hunger has increased. So I feel a desire to eat food after every 1 hour, after every 30 minutes. So these are the three cardinal or three major symptoms in the patient. They are known as three polys: polyuria, polydipsia, polyphagia. Excessive urine formation, excessive thirst, excessive food intake. Then they will have the complaint of weight loss, because they are having deficiency of insulin. So insulin is the anabolic hormone, and it builds up the stores for glycogen, fats, and the proteins. But when insulin is not there, glucagon becomes dominant, and glucagon is a catabolic hormone. So it causes breakdown of their stored fats, proteins, etc. So these patients will they will notice that they are losing weight, although their appetite has increased. They are increasing, they are eating a lot of food, but they are not gaining weight. And instead of even retaining, they are unable to retain their normal weight, and they are losing the weight. And plus, they will complain of extreme fatigue and irritability, because because the insulin is the hormone which is causing the synthesis, or which is causing the anabolism of the fat stores and the protein stores. But when the insulin is deficient, the glucagon becomes dominant, and glucagon is a catabolic hormone, so it will cause extreme protein breakdown. So there will be inside the muscles, there are proteins. So the protein breakdown in the muscles will also take place. So the person will feel tired, exhausted, and weak. So what happens in diabetes? The blood glucose is elevated. So there is hyperglycemia, or high blood glucose level. So kidneys are unable to reabsorb this glucose. So glucose appears in the urine. This is called glucoseuria. And when the glucose appears in the urine, it will drag water with it. So excess urination also occurs. And this loss of water in the urine, it can lead to decreased blood volume, and it can lead to circulatory failure. And if there is decreased blood flow to the kidneys, this will lead to renal failure and dehydration. Then fatty acids, fats are broken down because insulin is not there and glucagon is more. So it is a catabolic hormone, and glucagon will cause fat breakdown. So the fatty acids are released from the fat breakdown. So fatty acids are mobilized from the triglycerides, and these fatty acids will be used up in the formation of ketone bodies. And ketone bodies are actually, they are acids. So when there is excessive amount of ketone bodies in the body, this will disturb the body pH, and acidosis will develop. And this is acidosis, this will depress the function of the brain, because the neurons, the function, every cell of the body, it needs an optimal pH to work at its best. But if this pH of the body gets disturbed, then their functioning gets disturbed. So in acidosis, the functions of the neurons get depressed. So the patient will be like, his neuronal activity will decrease, and he will be less active. And if it is so much so, if the acidosis increases, and it increases to, it may reach to a level that his brain functions or his neurons are so much depressed that he becomes unconscious, or he becomes comatose. And also there is protein catabolism, or protein breakdown, which will reduce the growth, and it will cause loss of the muscles, or muscle wasting of the skeletal muscles. And plus, in addition, if these were the acute effects, but if there is, if diabetes, it's a long-standing disease, and in the long run, after 15, 20 years, many other complications of diabetes mellitus, it begin to appear, and they includes damage to the vascular system, like the blood vessels, and damage to the nervous system. The nerves get damaged. This leads to neuropathy, and blood vessels get damaged. This leads to major major artery disease, as well as some small size artery diseases. So these are the complications of the diabetes. So any questions?
Thank you.
Okay, so
I want to ask,
yes.
one of the symptoms is excessive food intake. So why the diabetes have an excessive food intake?
Yes, excessive food intake. Yes, good question. Actually, there is a hunger center. There are center in our brain. We have a thirst center. We have a center, hunger center or appetite center. When these centers are stimulated, you will feel more hungry, right? So in diabetes, the problem is that there is
hyperglycemia. There is high blood glucose level in the blood, but this glucose is unable to enter inside the cell, because glucose will enter inside the cell when there is insulin. It is the function of the insulin to cause uptake of the glucose from the blood inside the cells. If insulin is not there, glucose will not enter inside the cells, right? So although there is high blood glucose level in the blood, but inside the cell there is glucose deficiency inside the cell. Inside, although the cells are surrounded by the blood, which is having high blood glucose, but the cells cannot use this high blood glucose, because this high glucose in the blood, it is unable to enter inside the cells. So inside the cells, intracellularly, there is glucose deficiency, right? So there is glucose deficiency. So this levels of glucose, low levels of glucose inside the cell, the hunger centers, the neurons in the brain, they get stimulated when they feel that intracellularly there is glucose deficiency. So this hunger center, it will get stimulated when they notice that inside the cell we are having less glucose. So when there is intracellular glucose deficiency, this will stimulate the appetite center and hunger center, and the person will feel more hungry. So he will eat more food. His appetite will increase as compared to his past, and he will eat a lot. But still, there is no use of eating a lot, because he will develop hyperglycemia. The blood glucose level in the blood will increase. It will keep on increasing, but this glucose will be unable to enter inside the cell. And intracellularly, there is glucose deficiency, which will keep on stimulating the hunger center, and the person will keep on feeling the desire to eat more and more. Is it clear?
Yes, thank you. I appreciate that.
Okay. Any other question? Okay, if there are no questions, I will stop sharing the slides, and I will share the recording with you. And this was all about we finished all 4 lectures of endocrinology. And next Tuesday in the morning time, another doctor will be with you. I'll be with you again, boys and girls together, in the afternoon time next week for the tutorial of endocrinology. So we will be together online next week in the afternoon time. And today you have the lab physically on campus for the boys as well as for the girls. And good luck for your midterm exam, which you are having today, I guess.
Next week, Sunday.
Okay. Okay, good luck for that. Okay. Jazakallah khair. Massalama.